Hello, I'm Shiva Gopal, and I'm a practicing orthopedic surgeon in the East Riding of Yorkshire. I work at the Hull University Teaching Hospitals and at the Spire, Hull and East Riding Hospitals. And the area of interest where I practice orthopedic surgery is hip and knee joint replacement surgery, including redo hip surgery. And I also have a special interest in problems related to the sacroiliac joint. The sacroiliac joint, in fact, sacroiliac joints, because we all have two of these in the small of our back. They are joints that connect our spine. The bottom end of the spine is called the sacrum, and that bone connects to the ilium, which is the back half of our pelvis. They are very important joints because they connect our lower end, that is the legs, to the rest of our torso. There are multiple causes for the sacroiliac joints to start hurting. The commonest ones are, certainly it can happen if we've done a movement that we're not used to or sudden heavy lifting, but more often it's a slow wear and tear of the joint that presents just sometimes without any cause, but very often it's related to events in the past like pregnancy, where the pelvis stretches and it stretches the sacroiliac joints in ladies. It can happen after trauma, that is injuries to the sacroiliac joint. It can happen as part of the complex of what we call inflammatory arthropathy, or diseases that cause inflammation in the joints. So sacroiliitis can happen as part of the sacroiliac joint dysfunction as well. The sacroiliac joint dysfunction presents with pain in the small of our back, around the area just next to the midline of our, where the buttock crease or the natal cleft starts. This pain usually presents with the person actually holding on to that area, and it can then spread into the buttock area and into our thigh as well. And sometimes it can start mimicking pain that goes into the legs called sciatica. In that area, there are also joints called facet joints just above the sacroiliac joint. So it's very important that we distinguish whether this pain is coming from the actual facet joint or from the sacroiliac joint itself. When the patient presents to us, we always take what is called a history, that is to get the full details from the patient of the problems they are experiencing. That includes what type of a pain it is, where it is, and the character of the pain. We then go on to examine the patient, and there are very specific tests that can actually tell us that this is pain coming from the sacroiliac joint. So when the suspicion is high, after speaking to the patient and examining them, we can then arrange further tests like X-rays and scans, which will then provide us further information on whether we are dealing with a sacroiliac joint dysfunction. In most instances, sacroiliac joint pain due to sacroiliac joint dysfunction can be treated successfully. There are various methods of treatment available to do this, to achieve this goal. And in most instances, one of these treatments will tend to lead to a significant improvement in the person's symptoms, if not a total cure. When the pain first starts, if it has started as an acute, in other words, an event which has happened at within a very short period of time, people can take a bit of rest, and what are medications called anti-inflammatory tablets, along with paracetamol, which is a common analgesic or a painkiller, and a bit of rest, some ice packs, or at times even just massage in that area will help. But if the pain continues beyond what is getting controlled with these simple measures that one can take at home, then the patient should ideally be coming to see a physiotherapist or a specialist like myself so that we can take the treatment forward. The treatment then consists of specific exercises to stretch and strengthen the muscles in that area, along with massages. We can undertake injections, and a very tiny minority of patients may need surgery to fuse their sacroiliac joints to help rid of these symptoms in the long term. Exercises certainly do help with sacroiliac joint dysfunction. In fact, physiotherapy is one of the main modalities to treat this condition, but it would be preferable that the person first sees the specialist or a physiotherapist, understands what's going on, and then undertakes the exercises in a supervised fashion so they can treat themselves in the right areas using the right muscles to help themselves get rid of this symptom for them.